Hi, I'm Thiviya. I'm a pediatric neurologist and clinician scientist at BC Children's Hospital and the University of British Columbia in Vancouver. Thank you for joining me as I talk about a recent article titled Antenatal Diagnosis, Neonatal Brain Volumes, and Neurodevelopment in Transposition of the Great Arteries. It's important for us to think about neurodevelopment in children with congenital heart disease because, despite improvements in survival, these children remain at high risk for neurodevelopmental impairments. Neurodevelopmental problems are seen in up to 50% of children with transposition of the great arteries, and alterations in brain maturation and growth have been linked to neurodevelopmental problems in this population. So there is a growing body of literature focusing on understanding what factors promote brain health in children with congenital heart disease. And one of these may be timing of diagnosis of congenital heart disease. Specifically, faster white matter microstructural maturation has been observed in infants with prenatal diagnosis of congenital heart disease compared to those with postnatal diagnosis, suggesting that this may be protective. However, what we don't understand is how the timing of diagnosis of TGA and total brain volumes, used as a marker of brain maturation, interact to predict neurodevelopmental outcomes in this population. And this was the focus of our study. Our specific aims were to, one, assess whether pre and post-operative total brain volumes for a given postmenstrual age differed by timing of TGA diagnosis, and second, to determine whether antenatal diagnosis of TGA modified the relationship between smaller total brain volumes and poorer neurodevelopmental outcomes. We did this work in a retrospective cohort of 139 children with TGA. 77 of these babies were diagnosed antenatally. These babies underwent clinical pre- and post-operative brain MRI to assess for brain injury and also assess brain maturation by quantifying total brain volumes. And this is shown on the right of the slide. 18-month neurodevelopmental assessments were completed using the Bayley scales. We started by comparing clinical characteristics between infants with prenatal and postnatal diagnosis and found that there was more preoperative hypotension in infants who were postnatally diagnosed with TGA. We used generalized estimating equations to assess our first aim and found that total brain volumes at a given postmenstrual age did not differ by timing of TGA diagnosis. We also use generalized estimating equations to assess our second aim. And specifically here, our independent variable in our models was the interaction between antenatal diagnosis and total brain volume. Our dependent variable was Bayley scores, and we included important confounders related to neurodevelopmental outcomes and brain maturation in this population. And specifically, we included ventricular septal defect and moderate to severe brain injury. And what we found was that this interaction between antenatal diagnosis and total brain volume was significantly associated with cognitive scores at 18 months. So on the right, we have a figure that illustrates this relationship more clearly. We have brain volumes plotted along the x-axis and Bayley-III cognitive scores along the y-axis. Infants are separated into those with postnatal diagnosis in blue and those with antenatal diagnosis in red. So if we focus on those diagnosed postnatally, what we see is that with smaller brain volumes, there are lower Bayley-III cognitive scores. However, what's interesting is if we look at those babies in red, those with antenatal diagnosis, this relationship is no longer present, suggesting that antenatal diagnosis may be protective. So to summarize, timing of TGA diagnosis modified the relationship between smaller total brain volumes and poorer cognitive outcomes, such that this relationship was no longer present for those who were antenatally diagnosed. However, what's important for us to remember is that antenatal diagnosis is a complex intervention. And so the protective effects of antenatal diagnosis may be through several potential mechanisms. We found less preoperative hypotension in babies who were antenatally diagnosed in our study. And so, one potential mechanism through which antenatal diagnosis may be protective may be through improved preoperative hemodynamic instability. However, this warrants further study. Thank you so much for joining me.